So thanks for joining us today. We will be covering a webinar called Communication, a Catalyst for Growing a Positive Culture. My name's Katie Dively, and I am a research scientist and a trainer for the Center for Health and Safety Culture. Let's get started first by becoming a little bit more familiar with WebEx. So if you're having any audio difficulties or if you've somehow dropped the line, you can click on the little phone button at the bottom of your screen. And I actually think it might be at the top of the screen also, but a pop-up will appear and you'll have a couple of options for reconnecting. You can call back in or you can let it call you. Either way of those should work. Also, a little bit later in the webinar, I will be asking you a couple of questions that I would love your feedback on, and you can enter your responses into the chat window here that I'm showing in this graphic. So that will be in the chat window. And if at any point you have questions, please do ask those questions on the Q&A portion of your chat window as well. So we will also have time at the end of the webinar for questions, so feel free to wait till the end, or you can send those in throughout. The last thing I want to mention here is that we will be recording this webinar so that folks can watch it at a later date, and that will be posted on our website, but also on our YouTube channel. And I'll mention just a little bit more about that at the end of the presentation. The Center for Health and Safety Culture is located at the Western Transportation Institute at Montana State University. So we're an interdisciplinary center that serves communities and organizations through research and training and guidance, to cultivate healthy and safe cultures. Our main issues of focus are traffic safety, the misuse of substances, domestic violence, and child well-being. And if you're interested in more information on the center or on any of these issues that we're working with, feel free to go to our website and you can see some of our projects, you can see more about trainings and things like that. And again, I'll cover some of those points at the end of the webinar. So on today's webinar, I want to start by discussing what we mean by culture. Then I want to share how culture can impact our behaviors. Then we'll move to a discussion about the role of communication in a positive culture and provide some opportunities for creating intentional communication and conversations. Okay, so the title of the webinar was Communication, a Catalyst for Growing a Positive Culture. And if our goal is that positive culture, first we need to understand what we even mean by culture. So we define culture as the shared values and beliefs that influence a group of people. So a key word here to take note of is the word shared. So it's not just one individual's attitudes or values and beliefs. It's the majority of people. It's that group of people that share these values and beliefs. Now, take note, this is not the only definition. There are others as well. Definition that we use at the center and that I'm using today to be sure that we're all on the same page as we move forward. So now we're working to grow a positive culture. Note that we're growing positive, protective behaviors. This is an asset-based or a hope-based approach rather than a deficit model or a fear-based approach. We also understand that growing positive behaviors is about shifting attitudes and beliefs. So let's talk about what I mean by that. How is growing positive behaviors about shifting attitudes and beliefs? This is a simplified version of a larger behavior model. It helps us understand what's driving behaviors. So if our outcome is to grow more positive, protective behaviors, we want to take a step back and see what's driving or impacting those behaviors. So we know if somebody is willing or has the intention of engaging in the behavior, they're more likely to engage in the behavior. If they're not intention of engaging in the behavior, they're more likely to engage in the behavior. If they're not willing or have no intention of engaging in the behavior, obviously they're less likely or less willing to engage in that behavior. But what makes us willing or what makes us create intention to engage in a behavior? Well, this stems from our attitudes and beliefs about the behavior. And just for simplicity reasons here, I'm only going to use the word beliefs when we talk about this box here. So if we have positive beliefs about the behavior, we're more willing to engage in the behavior. If we have negative beliefs about that particular behavior, we're less willing to engage in that behavior. So these beliefs become really important. Okay, so one more step back. What is shaping our beliefs? Well, that would be our values. Now, our values aren't specifically tied to one particular behavior or another behavior. They're more broad in nature. It could be something like, we value leveraging our protective values that exist to shift these beliefs. Now, this is our goal, right? If we know, so this becomes really important, because if we can find what's shaping our values and our beliefs, we can really impact the behaviors that we're trying to address. This is our goal. We know that the values and beliefs come from a lot of different sources, right? They come from our family, how we were raised. They come from our parents, maybe from our religious communities or our schools. They're shaped by many different factors. And we could say that these values and beliefs come from our culture. So we're seeking to grow a positive culture that impacts these behaviors. So that was a simplified version of this larger behavior model. This is the model that we use to predict behavior, and I'm simply showing it because I want you to understand the complexity of a model. In comparison to the simplified version. So this simplified version is still very helpful. It really helps us understand what's driving behavior. And again, if any of us or even all of us are trying to shift behaviors towards more positive behaviors, then I suspect that we're seeking to figure out how we're going to do so as well. So if we're looking at the how and we're thinking about different strategies that we might want to initiate to address our issues, we want to look at different programs and strategies that are looking to shift beliefs now that we know how important our beliefs are in changing behaviors. This area of the beliefs becomes our focus. So we want programs and strategies that are intentional experiences designed to change beliefs. And what do I mean by intentional experiences? Well, this could be an evidence-based curriculum. This could be a new policy. And what do I mean by intentional experiences? Well, this could be an evidence-based curriculum. This could be a new policy that we're proposing. It's something that folks are experiencing. And these are places we want to be sure we're focusing in on beliefs. So let's look at a couple of examples of these. Here I'm just picking one curriculum that's often used in substance abuse prevention. You might be aware of it or familiar with it. This is called Too Good for Drugs. So when you look in or dig a little bit deeper into Too Good for Drugs, you'll learn that the curriculum seeks to change these beliefs. So first, the perception of harm. Because if I believe that something is harmful, I'm less likely to be willing to do that. Attitudes towards drug use. And violence also. If I have unfavorable attitudes, I'm less likely to be willing to engage in that behavior. Now, the perceived norm of substance use. So if you're engaging in an evidence-based curriculum, you'll really want to dig in and figure out what are those beliefs that it's trying to change. Read up on the program or reach out to those developers. These are great strategies, but you'll also want to know what are those beliefs that it's trying to change, and does that align with the beliefs that you're looking to change in your community? You really want to see that alignment. So another example here. So you're probably familiar with high visibility enforcement. Another strategy to here, click it or ticket would be an example of high visibility enforcement and a way to increase seatbelt use. So the beliefs behind this strategy would be that it's increasing the perception of getting caught not wearing your seatbelt. So if I believe that I'm going to get caught, I'm more likely to be wearing my seatbelt. These efforts also seek to increase the perception of harm. That perception of harm of what could happen if we're not wearing our seatbelt. So again, if I think it's unsafe, or if I think I could be harmed by not wearing a seatbelt, well, then I'm more likely to wear that seatbelt. The next example is a family program called Strengthening Families. So if you were to learn more about this program, you'd find that the beliefs that they're focusing in on are called parent control beliefs. That parents have the parenting knowledge or skills necessary to engage in these very important parenting behaviors. Control beliefs are really important beliefs because if I know how to effectively parent, or if I know that I have the skills to do so, well, then I'm much more likely to engage in those parenting behaviors being taught in this program. So the program also seeks to increase that perception of social support. The belief that there's a supportive around me, that there's help if I ever need it. So if parents believe that there's that support around them for what they're doing, they're more likely to be willing to give these parenting behaviors that they're learning about a try. So in summary, it's really important to start to ask yourself, do we know what beliefs we're trying to shift here locally in our efforts or within our organization? And are the strategies that we're engaging in aligning with that? So do a little bit of digging. I think it's not difficult to find these beliefs, but it's important that you do so. So I'd ask the question, what are these strategies, what do these things have in common? Well, I'd say that's communication. And I would say any prevention strategy uses communication in some form. It's integral in all that we do. So it provides us with a very opportunity. We have this awesome opportunity to use intentional communication within these strategies to shift beliefs. And I'm actually going to say that again because I think that's important. We have a unique opportunity here to use intentional communication within our strategies that we're engaging in to shift the beliefs that impact behaviors. So often when we discuss communication as a strategy to improve health or to improve safety, our minds often go to a media campaign. And I do want to chat about media campaigns for a bit here. Media campaigns can be an important part of your prevention portfolio. And a portfolio here being suggested because, we can't solve everything with just one strategy, right? We need a variety of strategies in order to be effective. Okay, so it can be an important part of our strategy portfolio, but it alone won't change beliefs. Also, media campaigns are incredible, but it alone won't change beliefs. Also, media campaigns are incredibly difficult to do effectively. They've got to be grounded in good science or a theoretical framework for changing beliefs, like I've shown you, and they require lots and lots of dosage to be effective. So it's something to think about. I have a lot of communities that I work with, or a lot of organizations that I work with, that automatically jump to engaging in a media campaign. And we really have to question ourselves about whether or not we have the capacity to do a media campaign that's grounded in good science. And do we have the resources that are necessary to attain that adequate dosage in order to be effective? I like this little bit of research here. It says the mass media campaigns that were reviewed were generally carefully planned, well executed, attained adequate dosage, audience exposure, and were implemented in conjunction with other ongoing prevention activities. And in this case, it was high visibility and we can use when we're implementing our campaigns. And I would say not only campaigns, but any of our strategies, really, any time we communicate, I think we can have a couple of different frames. So we can use a fear-based frame, which, the goal is that if I scare you enough, you're never going to want to engage in that behavior. But we also have to take a look and see, are there any unintended outcomes? And we know from lots and lots of research that there actually are unintended outcomes, that take place as a result of fear-based strategies. They can label and stigmatize populations. They can expand social gaps in our communities or within our organizations, and they can even promote poor health as our value. And I suspect this is, definitely not something that we are looking to do, any of us on this webinar, specifically when we're trying to grow a positive culture that influences our behaviors. So another frame to consider would be a hope-based frame. This is where we focus in on what we want to grow. We shine a light, or we acknowledge what is working, so what are those positive beliefs, or what are those positive behaviors taking place, and seek to grow those and build on those. But what do we mean by hope? So hope is the perceived capability to derive pathways to desired goals and to motivate oneself to use those pathways. So it's kind of broken down into two different pieces here. We need that willingness or that motivation to move forward, but also the will, which is the will. But I'd also say we need that path forward, which is the will. But I'd also say we need that path forward, the way. So we need the will, that motivation, but also seeing that path forward is incredibly important, the way. So if we flip it around, if we don't have the will, or we don't have that path forward, if we only have one without the other, we're not going to act. We're not going to engage. So we really do need both here. We need that motivation, that willingness, and also seeing that path forward. There's a lot of research around hope. We know that hope can bring improved academic and athletic performance, engagement in prevention activities, and improved physical and mental health. And I suspect that pretty much all of us on this call are looking for one of these things, if not all of them. So as you can see, it's not some happy or silly, kind of notion. It is grounded in good science. And we acknowledge also in our work, and this is really important to hear, that we do grow hope. Maybe, hope that prevention works, or hope that we have strategies to move forward. It's about growing concern and hope. So we've been discussing media campaigns here and different frames for communication. Again, communication being absolutely key in any of our strategies. So knowing this, what about using media campaigns as a catalyst for conversation? Conversations is another form of communication, but one we often, I think we miss out on or we don't even think of in prevention. So a media campaign could be a great way to spark a really meaningful conversation in our work. So let's talk about conversation for just a bit. We know that it's crucial for improving health and safety, perhaps one of the most important aspects of our efforts. It's imperative to changing beliefs. We can have conversations with, this might look like, is it time that I take a serious look at how often I exercise? Or we might be asking ourselves, am I drinking too much? We also have conversations with others. Something like, we need to talk as a family about cell phone use while driving. Or it could be something like, I'd like to talk to you about how much you've been gambling. As you can see, these can be incredibly hard, yet important conversations to have. But conversations are important. They help us build relationships. They help us connect deeper with the group or with the individual that we're talking with. They can help us establish a shared purpose to get on the same page before we move forward. They help us grow a shared understanding and provide more context that we might need. And we do this, right? We do this all the time. It's not like we, help us grow a shared understanding and provide more context that we might need. And we do this, right? We do this all the time. It's not like we, hand over a manual maybe to our children for how to clean their room or just how to drive a car. We have conversations with them to teach them. It's more about that conversation where others can learn. We also have conversations with our partners, to grow a shared understanding of maybe a situation that we're in. So why wouldn't we build in conversations about these really important issues that we're working on, these issues to improve health or these issues to improve safety? So this becomes a really good question that we want to start thinking about, and we want to start asking ourselves, how can we create opportunities for conversations within our prevention strategies or within any of those strategies that we're using and intentionally build these opportunities for conversation in our strategies? I'm going to show you just a couple, just two projects that we're working on at the Center for Health and Safety Culture, where we intentionally created opportunities for conversation within the strategy portfolio that was taking place. The first project that we'll discuss is a project that we engaged in with the West Virginia Partnerships for Success grantees, and they were working on substance abuse prevention. The other is a traffic safety project that we're working on in Utah aimed at increasing rural seatbelt use. So let's start in West Virginia. So the purpose of this project, simply to give us a shared understanding here, is to reduce underage drinking and the misuse of prescription drugs among youth by growing protective behaviors across the social ecology, or those different layers of influence in our communities. Ecology, or those different layers of influence in our communities. This could be with parents, with law enforcement, with schools, with healthcare providers, and so on. So all of these groups were working to reduce underage drinking, or are important to the reduction of underage drinking and the misuse of prescription drugs. So what we did to help incorporate conversations into the mix is that they hosted annually a community dialogue session where each of the 12 counties that we were working with were asked to host this evening event, inviting community members to come out and have a discussion about these issues. So one year, and these were very well-planned, well-organized events. So one year, the dialogue sessions focused on growing certain behaviors. So certain behaviors that were shown to reduce underage drinking and the misuse of prescriptions at each level of the social ecology in their county. So in a World Cafe style approach, or the small group conversations at tables, they were asked these questions. What are the challenges we face in growing these behaviors, and how can we overcome these challenges? So I'll give you an example here. If the layer of the social ecology happened to be parents that was being discussed, they might have been discussing the behavior of increasing family rules around, their family members under 21 using alcohol. So family rules would have been that behavior. So then at the small tables, they would be discussing, what are the challenges in increasing family rules? And then what are some of the strategies to overcome these challenges? And the same conversations then went on when they were discussing specific behaviors they were seeking from law enforcement or seeking from healthcare in these cafe sessions that were taking place across the state. It's interesting to see what comes up, and I think one of the best things is that there are so many new connections being made. And it's not just connections with other people, but connections and new understanding about the issues themselves, and also about the strategies that are taking place to address the problem. And I think it's cool that they have an opportunity to engage with others in their county, but they also have an opportunity to engage with the professionals that are working on that specific issue. And I think a byproduct that maybe wasn't intended in these community cafe sessions was that they turn out to be a really great source of energy for the effort too. And specifically here, in West Virginia, or in any place that you're working in substance abuse prevention, I think we can all use a little boost of energy, for those efforts. So that's a cool side impact as well. Those efforts. So that's a cool side impact as well. So next, another example here is with Utah and with the Utah Department of Public Safety. So the purpose of this project is to increase seatbelt use in 7 rural counties by focusing in on 5 stakeholder groups. And similar to the West Virginia project that we just discussed, we're seeking to grow, protective behaviors among families, and that could be making that family rule. With law enforcement, like modeling seatbelt use themselves or strongly enforcing the seatbelt law, among schools, among work sites, and key leaders. So hopefully you notice that is across the social ecology as well. Each group's focus was a little bit different because they had a different set of protective behaviors, all of which ultimately working to increase seatbelt use throughout the county. So after conducting surveys, 98% had reported that they had a worksite policy requiring them to always wear a seatbelt, but yet only 58% reported always wearing their seatbelt. So while they had a policy in place and they knew about the policy, there was still something missing here. They weren't always buckling up like they knew that they should be, to follow that policy. So part of this project, became, how can we incorporate conversations about this? So we created a tool here, a tool to have a conversation, to host a conversation for the department on these survey findings, and to really get at some of those key beliefs behind, why folks might not be wearing their seatbelt, why officers might not be wearing their seatbelt. And honestly, these couldn't have been easy conversations to have, but they weren't in any way might not be wearing their seatbelt. And honestly, these couldn't have been easy conversations to have, but they weren't in any way trying to be, authoritative or punitive. They really were just to open a constructive dialogue about their beliefs. And there were also other tools provided to have open, constructive conversations about other things that were found in the survey, or just other, goals or behaviors that we wanted them to engage in. But it really stemmed around the importance of having a discussion as a group about engaging in these protective behaviors. So just 2 examples there about how we intentionally created opportunities for conversations to shift beliefs. So when it comes to conversations, we acknowledge that there are easy conversations to have, and there are difficult conversations to have. And if, we tend to avoid the difficult ones, but unfortunately those are probably ones that are more likely to shift beliefs. The easy conversations that we're having either with ourselves or with others are probably easy because we're in agreement about whatever it is that we're discussing. What makes it a difficult conversation is often because there's some sort of disconnect or there's some sort of conflict. But what can help us navigate some of these difficult conversations that are hard to have? Well, the first is gathering courage. So it's not that we're not afraid to have this conversation, but it's that we're moving forward and having it even though we're afraid. It's about, and sometimes in order to move forward, we can ask ourselves the question, what will change if we don't have this conversation? Will anything change if we don't have it? Difficult conversations can threaten people. It can, make them feel conversation. Making sure it's at a good time for that other person or for the group you're having the conversation with. Let's not do it at a time where we know we might be rushed, either yourself or that other person or the group, because these often take place, these difficult conversations can certainly take place, within a meeting. Perhaps it's a team meeting, perhaps it's even a coalition meeting. So you want to be sure that you've created enough space, for the conversation. Maybe you don't have, too many agenda items on the agenda that day if it is a meeting. Also do it when you're not too tired, when either you're not tired or the other person isn't, or your group isn't exhausted after just, handing in some big deliverables, but making sure that, people are kind of in the right mind and in the right space to have the conversation. The space is also really important. Having the location is also really important. Having the location being a private, kind of comfortable space that's conducive to conversation is really key here. And if you think about it, sometimes it's easier, and this is okay. So if you're having a conversation with somebody else, sometimes it's easier to have that conversation if you're sitting next to them and maybe you're both looking forward and you're not making eye contact. It's okay to do it that way. And you might think back on if you've had any conversations with your significant other or your child in the car where you're both facing forward and not having to look each other in the eye. That's okay. One thing that's incredibly important about conversations is listening. And I think anytime we want to listen, we want to try to clear some of the voices that we have in our heads. So we might have voices in our heads of judgment. Perhaps might have voices in our heads of judgment. Perhaps we're judging what that other person or what that group is saying. Maybe we have voices of cynicism, like, ugh, I don't believe they're ever going to change, or this is never going to work. We can also have voices of fear in our heads. And, it might be something like, oh, I can't say that, it'll hurt their feelings, or they're going to laugh at me if I suggest that. So, if we can clear the clutter, if we can quiet some of these voices in our heads, I think we really provide ourselves with an opportunity to really listen and to really engage. And keep in mind, you might have to do this, help someone else clear their clutter or, quiet their voices that they have so that they can really listen. To help a conversation, we are successful. And it's not about closing or creating closed-ended questions where we're, allowing the person to simply say yes or no. We want open-ended conversations, open-ended questions that allow, for that conversation. Not ambiguous questions, but straightforward, clear questions. And again, these can be a great way to start that difficult conversation. So I want to take a moment here, knowing kind of what we've just talked about in terms of these difficult conversations, but really how important they are in our efforts to improve health and safety. I want to take the time now to ask you, what are some of those important questions that are not being discussed in your current efforts? So what are some of those questions, or what are some of those things that are not being said, or that are not being said, or are not being asked, but could really maybe move you forward in your efforts? And I'd ask that you please write your responses or type your responses in that chat window. Interesting, somebody says, we've never actually sat down with a group of people that aren't wearing their seatbelts, to really talk with them and ask them, why aren't you wearing your seatbelt? Or what are those beliefs? Interesting. Looking to ask more questions about the root causes of traffic safety. Talking about promises that were already made. Oh, this is a good one. How do we know what's working, or how do we know what we're doing is actually having an impact? Boy, that is such a tremendous question, and boy, is that a hard question to ask, right? Especially in a group of people where we're excited, we've been engaging in this, strategy or whatever it is for a long time, to stop and ask the question, are we effective rather than just busy? That's an excellent question. Right. Well, I think those are awesome. And I'd love for you to continue to think about that. What are those questions? What are those conversations that we're not having? But if we did have those conversations, would really advance our issue, or at least take it to the next step, or at least get the conversation started that's never even taken place. So next, I'd ask you to also write in your chat window, what could you do to begin that conversation? So again, write those in the chat box. Is there something that you could do to begin that conversation or to ask that question? How could you start that? Have a group brainstorming panel. Absolutely. Quiet the voice of fear in my head. Without a doubt. Have a group brainstorming panel. Absolutely. Quiet the voice of fear in my head. Without a doubt. Lead by example. Explain why you're doing it a certain way. Yeah, reach out to evaluators to help, especially if we're trying to answer that question of, are we seeing the impact that we're hoping to see? Maybe it's conducting an anonymous survey, to really check in and see where folks are at. Moving from more of a stand-up presentation style to a cafe-style dialogue discussion in class. Yeah, very cool to really seek that opportunity to create conversation and to allow that wisdom to flow throughout the room. Insight. Yeah, maybe even doing doing a survey within their own organization to really understand where people maybe internally are at. Great idea. So these are awesome. I really appreciate you taking the time to think about this a little bit, and I hope you continue to do so. And do this as a group or as a team or as a coalition, however you guys operate. Ask them this question. What are those difficult conversations that we're really not having? I think this could really advance your work. So now I'm going to take some time to do a little bit of a review of what we've talked about today so far. So we have talked about how growing a healthy and safe culture is about growing protective behaviors. So now I'm going to take some time to do a little bit of a review of what we've talked about today so far. So we have talked about how growing a healthy and safe culture is about growing protective behaviors. Also, that growing protective behaviors requires changing attitudes and beliefs, and that at the root of shifting these attitudes and beliefs is really the communication and the conversations that can take place. So I'd love to open it up now to some of the questions that you have, and I'll also take a look at what's been asked in the Q&A box as well. But know that when we are finished with the questions, we will continue on with just a little bit more about some of the other webinars that are going to be taking place down the road, and some other services and training opportunities that we have looking forward into 2019. Maybe it is just easier for you to enter them into the chat window, because then I can read them out loud without unmuting everybody. Absolutely, and I'm seeing them too here, Kelly. And I would also allow for any of our staff to chime in as well. So I'll just get started with that first question. How do you measure and quantify positive culture change based on communication strategies you use? So how do you measure and quantify positive culture change? So those shifts maybe in the values and attitudes and beliefs based on the communication strategies you use, and quantitative data to start to capture what some of these beliefs are and how they're changing. Jay, do you have anything else to say specifically there? I'm asking Jay Otto. Jay Otto is a colleague of mine and works specifically a little bit more into the data component on our team. There's another question here about creating that space for intentional conversations, and just as an example, maybe on seatbelts in a cafe type setting. So the question is, what's the draw to get people to the event? Because, it's hard to imagine that a large group of people are going to come to an event where you're just going to talk about seatbelt use, right? Well, that's an ongoing challenge in any of the issues that we're facing, right? We've got really busy partners and community members. So recruiting folks to the event can be challenging, but there are definitely some ways that certain groups have made it successful. And I think, it's about establishing whether you're on a invitation that you're creating, or in a conversation maybe that you're having with partners, but you really want to establish the concern so that people understand, and if it's seatbelt use, perhaps, what are our current numbers, potential life loss, and all that kind of stuff. So we want to raise the concern around why seatbelts are so very important, but also hope. We want to, sort of do both, raise the concern, but also show hope that, we as a community, we have a variety of strategies here that we can use to increase seatbelt use, and that we have a very strong majority maybe of people that have really favorable beliefs about seatbelt use, and of course a strong majority of people that are already using their seatbelts. So we want to convey, I think that part of the conversation is important to get people at the event. Convey the concern, convey the hope, and I would say also be clear on how important their voice is. It's not just that they're coming to an event to hear a presentation about seatbelts, but that they are going to be part of that conversation, that their voice is critical in moving this forward, and that you really acknowledge, you really value their feedback, that you really acknowledge, you really value their feedback. Lots of groups have done invitations, kind of nice invitations that you might send for a party or something like that, and send those out. We certainly have groups that have just sort of saved those nicer maybe invitations or even hand-delivered invitation to some of those key stakeholders that you really want in the room. So I think it's not only what kind of goes into that invite, but also how are you presenting it? Are you just kind of putting it up, but with, on community billboard or community little, what do you call those, bulletin boards? Or are you actually making that invitation special and really acknowledging that you need that community's feedback and voice in this situation? Okay, so another question that comes in here is, how can I turn it to more of a discussion style to have these conversations with students? So traffic safety courses, a lot of people, so 500 people per month on average, and really 100 people at a time. So how do you have meaningful discussions in that large of a group? And honestly, and of course, I'll invite any feedback from my colleagues that have done this in the past. But, I have been at events where we have done small group conversations with 100 people, even 200 people. And I think that's one of the beautiful parts about the World Cafe style of event, is that it really does break you down into these small groups, but having a really guided conversation. And I think that's key too, especially when you have so many people, is that you have a clear kind of facilitated guide of what those questions are, of exactly how long those folks are going to talk at each table. Also a reporting mechanism where, people are given a little bit of time to report out some of those themes from their group before everybody maybe stands up. And if they're doing that true World Cafe style, stands up, moves around, and sits down with new people the next round for conversation. And if you're if you haven't done the World Cafe style approach, Juanita Brown and her colleagues created this, and you can Google her work in the World Cafe style discussion, and she provides a great template there of how to engage in this event, things to prepare for, questions to ask. So it's a great tool for you. But it's definitely possible, I think, with large rooms, and I think that's the best part of engaging with a large room, is to really break it down into those small conversations. Give it another little bit here. If anybody wants to ask another question. Ooh, here's a question that came, sorry, I missed it. It came up in my chat window. A good one, a hard one, but a good one. How do you think to succeed in a community? It definitely impacts your ability to succeed in a community. I would say yes, it does, definitely. And if so, what would you say is the best means of creating a relationship, a relational environment in a coalition? Boy, this is really a really great question, and something that I personally, wrestle with a lot in my role at the center. I work with lots of coalitions across the country, and have in the past as well, and even my own coalitions locally. And when let's just go back to that behavior model. When there's not a strong culture or a protective culture or a positive culture, within that group, maybe it's the coalition, maybe it's your staff members or your team, boy, that absolutely impacts how you move forward and what are those behaviors that you move forward with. So it takes work, but it's absolutely possible. There are different, and Nancy, I can follow up with you on a couple of different ideas there, but I think it takes, kind of connecting first around the why. Why are we all here? Kind of let's get down to the basics here. What do we value? Why are we here? What's connecting us all? Get that shared understanding first, and then start to understand, what's the issue here? What's the issue maybe that we're working on? What is our, meaning like the coalition's issue, not their personal issues. Like if we're working on traffic safety or if we're working on substance use, do we all understand, maybe the issues? Do we understand them differently? Is that what's causing some of this relational disconnection that's taking place, and having some really maybe difficult conversations there, relational disconnection that's taking place, and having some really maybe difficult conversations there. But I think until you have some of those deeper conversations about why are we here, what is our goal of this group, and how do we see the situation, I think it's incredibly difficult to move forward. I've also seen coalitions, and I've been part of this in my own local coalitions as well, where we do coalition surveys annually to check in on those kinds of things, to really hear and invest in the voice of the coalition members to figure out, is it working for them? What are some of the barriers that they see to moving forward? What are some of the issues that they're hearing or seeing that are preventing them from moving forward? So there are a lot of tools also on doing that. And you might check the community toolbox from Kansas University. That does impact your ability to move forward on the issues when you're having some internal, culture issues. Okay. So we're going to move forward, and if anybody has questions after the webinar, you can certainly reach out to the center, and I'll be happy to chat with you a bit more about that. So the next webinar that we'll be having is moving beyond bystander engagement, growing citizenship to improve health and safety. Now, this is going to be delivered by our own Dr. Carrie Finley from the center, and she's going to introduce this concept of growing safety citizenship behaviors. You're not going to want to miss this. This one is really, really cool, and I think impacts any of our issues that we're working with. So this is going to be on February 12th. Also at noon, and you can register on our website. Also at noon, and you can register on our website just like you have for today's webinar. The next opportunity that we will have available is actually a larger training, and this is our Positive Culture Framework training. We'll have this open training to anybody who, anybody is welcome to join us, and this will be in September in Nashville. Now, we haven't pinpointed every detail of this training yet, so there's more to come, but I just wanted to let you know that is coming up here and this is an annual training for us, coming up here this fall. Now, just a note on this training, we had our last training in September, and that was held in Savannah, and there was a lot of interest here. We had to create a waiting list for registrations, and unfortunately, we had to turn some folks away. So if you are interested in this, it's a 2.5-day training specifically about our framework, the Positive Culture Framework. Specifically about our framework, the Positive Culture Framework. So the framework, the process for engaging in the framework, and also 3 critical skills that really impact the effectiveness of your efforts. So if you are interested in that larger training, register early if you're able, because we certainly want to get everybody in that we can. And of course, more information will be coming out on that, and continue to check back in on our website. So some other services that are available through our organization. I mentioned the Positive Culture Framework here, and that we have an open training for that every year, and that's a 2.5-day training. But also know that we come to you for that training. So if you have a team of people or an organization or a coalition that you would really like to have trained on that framework, for improving health and safety, and then by all means reach out, because we can certainly come to you all and provide that. One thing I mentioned just very quickly a couple seconds ago was that there were 3 critical skills that really impact the effectiveness of your efforts to improve health and safety. And those are communication, leadership, and integration. Communication, obviously important, or we feel it's very important. We did a webinar on it today. And as I mentioned earlier, communication is absolutely integral in any of our prevention strategies. So this discusses, different communication skills. We go into depth with social norms marketing, also a critical belief that impacts behaviors. And the next would be leadership skills. Leadership being critical in our ability to lead people towards, we find if leadership is missing locally or within the organization, boy, things can really fall apart. So leadership skills. And then finally, integration. So integration is, if you think back, I mentioned earlier that we need a variety of strategies to be effective in our efforts. And integration is really the work of aligning these strategies. So it might be, maybe it's mapping out the current strategies that you have. Maybe it's, seeing if you have duplication. Maybe it's removing some strategies if you need to, because maybe they're not performing, maybe they're not working, or maybe you have holes where you need to add in some strategies. So the skill of integration really, or the skills of integration really help us manage that portfolio of strategies that I had referenced. So these, any of these 3 skill trainings can be offered in either a 1 or a 2-day format. So it's important to know that. And again, those 3 trainings would be delivered, and that's gone through our Positive Culture Framework training. And with this service, you have someone from the center, and I'll just say that's me. My role is as a guide to help support you through your implementation of that framework. So you're learning about this, frame and process for improving health or improving safety, either, locally within your community or perhaps within your agency. But we all know what that feels like, to leave a training, have this great maybe binder of materials and all of these ideas in your head. And then you get home and you're like, oh, either A, we're really busy and we forget all about it, or we're overwhelmed because we really don't know how to get started. And we try to give all the best resources that we can do, but sometimes you just need that other little boost of support. So that's why we developed this guide service to really provide that support and walk you through your efforts of implementing the framework in your community. So that looks like resources that we can do, but sometimes you just need that other little boost of support. So that's why we developed this guide service to really provide that support and walk you through your efforts of implementing the framework in your community. So that looks like regular phone calls, emails whenever you need, tools and tips and documents and all sorts of different just supportive things that you might need to move forward and to advance in your efforts. And every group that I work with is a little bit different because they're all at different stages, maybe stages of readiness or just some haven't picked an area that they really want to work in. Some are, have been doing it for many years. So it looks different based on each group that we work with. The center also offers services in, survey work and assessment work, but also evaluation support. So that's something to think about. And we also have this free webinar series, and you are clearly aware of some of that, but continue topics to this list. And I want to just point out, these are a few of the recorded webinars or webinars that we've recorded in the past and have posted on our website. So these are all what we would consider archived webinars. And I think it's important, if you have interest or you want to learn more about what our framework, the Positive Culture Framework, is for improving health and safety, for growing that positive culture, have a listen to this webinar that's archived, and it's called What is a Positive Culture Framework? It'll help you understand a little bit more. It might also guide your decision about whether or not you want to come to one of our trainings or host one of our trainings. We also have those a webinar on the 3 critical skills that I mentioned above, on leadership, on communication, and integration. So there's a webinar that captures all 3 of those. There's a great webinar on the science of stigma. So stigma is something that many of us work with and are seeking to address in our community ecology. So I mentioned those different layers of social influence within our community that really influence what we believe and how we behave. So a webinar on that. A webinar on the challenges of fear-based approaches. We covered, just a snippet of that. So more on that. And then more information and a webinar on that idea of building hope and concern, and how important it is to do both, and how we can grow concern without creating this place of fear where people are possibly too scared to act, or even too maybe lost. They don't even know what to do because we haven't even provided them a path forward. So a really great webinar there on hope and concern. So we do have these listed under training in our website. You can go under webinars, and they're listed under archived webinars. So take a look at those. So we do have these listed under training in our website. You can go under webinars, and they're listed under archived webinars. So take a look at those. And honestly, just reach out to us. Connect with us if you have any questions as a follow-up to this webinar, or if you have any questions just in general about any of those services that we provide or any of the projects that we work on. So thank you for joining us today as we wrap up today's webinar. I just really do want to send out that thank you for being with me, and also for joining in on that conversation and to entering those statements and those questions, those difficult conversations, perhaps that you need to have in your community. So thanks for participating in that. So I hope you see, how important communication is in our efforts to improve health and safety. Being intentional about communication and weaving conversations really help us shift those beliefs that are so strongly tied to the behaviors we're seeking to address and seeking to shift towards more positive, protective behaviors. So with that, I'll close today, and thanks so much for being part of it. Thank you.